So the Healthcare Access Task Force organized today's protest to call attention to Carle Clinic's harmful and discriminatory practices that deny care to thousands of Champaign County residents. We're here to demand an end to these practices and to demand a right for all county residents to get the health care that they need. Before I talk to you about the healthcare access crisis and what the Healthcare Access Task Force is asking for, I want to take a moment to introduce our speakers. So today we're going to hear from Jeff Scott. He is another Healthcare Access Task Force member. He's going to talk about a very disturbing letter that he received from Carle Clinic regarding pregnant women getting access to Carle Clinic. You'll also hear from Carle, who's here with her family. She's going to talk about how 3 generations of her family locked out of Carle Clinic and denied access. Ron Aker is also a member of the Healthcare Access Task Force. He's an intersection consumer, and he's going to talk about what the Healthcare Access Task Force wants. And lastly, we'll hear from Claudia Lenhoff, the Director of Champaign County Healthcare Consumers, and she's going to talk about the delegation of task force members that's going to go in to Carle Clinic and deliver a Thanksgiving Day card, where we're going to demand that they change their Carle Clinic policies. The media are invited to follow the delegation as they go in to deliver the card. I want to take a few minutes to talk about the healthcare crisis and why we're protesting Carle Clinic today. We're experiencing a massive healthcare crisis in Champaign County. Close to 40% of our residents are locked out of the healthcare system because both major physician clinics, Carle Clinic and Christie Clinic, have enacted policies that limit or deny appointments and services to patients with Medicaid insurance, patients who are uninsured, or patients with insurance but have medical debt. Together, Carle and Christie Clinics have 90% of the doctors in Champaign County. So as a result, these patients have virtually nowhere to go for primary or specialty health care. When people don't have access to primary health care, they end up in the emergency departments of places like this hospital and Provena. And that's the most expensive form of health care for those individuals and for taxpayers. So in response to the crisis, the Healthcare Access Task Force was started by the Champaign County Healthcare Consumers. It's comprised of community members who are looking for a lasting solution. They're dedicated to working to end this crisis and come up with a solution that guarantees quality, affordable health care for all Champaign County residents. The Healthcare Access Task Force is looking for solutions at the federal level, the state level, and local level. Locally, one solution is clear. Carle Clinic and Christie Clinic, they must open up their clinics to all residents of Champaign County. They need to take their fair share of the 75,000 Champaign County residents that have Medicaid insurance or lack insurance. Carle Clinic has publicly promised the community that it would expand access to people with Medicaid and all kids insurance. But we'll hear from our speakers that actually they're still actively discouraging people from getting care at Carle Clinic. Carle Clinic also limits and denies care to uninsured patients, which leaves tens of thousands of Champaign County residents without access to needed health care. The Healthcare Access Task Force is protesting Carle Clinic today to demand an end to its harmful discriminatory policies. I want to share some good news because I think we've had a major impact. Last week when Carle Clinic learned about this protest and learned that we'd be talking about the letter that they sent out to pregnant women that Jeff is going to talk about in a moment, Carle Clinic announced to the public that they are now accepting more Medicaid patients, that they have plenty of capacity to serve those Medicaid patients, and that they'll no longer be sending out this letter to pregnant women. So we applaud, we celebrate Carle for making this change, but we want to encourage them to publicize this change. We also want them to open their doors to the 54,000 uninsured residents of Champaign County. So in the spirit of Thanksgiving, we are asking Carle Clinic to open its doors to the thousands of Champaign County residents who would be thankful to finally have access to timely, affordable health care this season. And by working together, we're going to create a healthy community in which everyone has access to health care. Yeah. So Jeff Scott, a member of the Healthcare Access Task Force, will talk to us.
Hello, I'm Jeff Scott, and I I speak as a member of the Healthcare Access Task Force. I came out today for the same reasons many of you did. To recognize the great disparity of healthcare access in this community, to claim it unjust, to demand change, and to hold Carle Clinic accountable. After joining the Healthcare Access Task Force last spring, I first read about how the local clinics were the target of a lawsuit filed in June by the Illinois Attorney General. Allegedly, in violation of antitrust laws, Carle Clinic conspired with Christie Clinic to boycott new Medicaid patients in search of primary care. As a result of the clinic's actions, wait lists for services at Francis Nelson grew exponentially, as did the number of emergency room visits made by families with Medicaid. In effect, driven by the desire for profit, the clinics greatly compromised the medical interests of this area's most vulnerable residents. Not long after the lawsuit had been filed, I began to see stories in the local paper about the clinic's plans to take on more Medicaid clients, specifically through the All Kids and Family Care programs. The clinics seem to be supporting Illinois Health Connect, a statewide effort to expand access to the medical system for those unable to afford private health insurance. The Attorney General's lawsuit and the client's promises to participate in Health Connect seemed incompatible, and thus, in my mind, the level of commitment by the clinics to our communities medically underserved remained in question. It was in this context that my wife and I initiated contact with Carle Clinic early this fall in anticipation of our second child. We got a letter from the clinic's Patients, Accounts, and Financial Services Division with information regarding insurance coverage. Along with an itemized cost breakdown, the letter detailed the kinds of insurance for which Carle Clinic was not a participating provider. Considering Carle Clinic promised in the summer months to serve more Medicaid clients, I was shocked to read the lines that are highlighted on the board here. They read, "Please be aware that Carle Clinic is unable to accept new Illinois Department of Healthcare and Family Services, All Kids, etc." So, if you have no insurance and are planning on applying for IDHFS Medicaid through the Moms and Babies program and are not currently a patient with the OB department in Urbana, you will need to contact either Planned Parenthood or Francis Nelson Healthcare for prenatal services. The letter continued, "You have 30 days after the birth of your baby to let Carle Clinic know of the baby's coverage. Carle Clinic is no longer able to accept primary IDHFS coverage of new patients, and if IDHFS or All Kids will be your primary coverage for your baby, you will need to contact either the Department of Public Health or Francis Nelson Healthcare for well baby checkups." Although this letter is not dated, my family and I received it within the last 6 weeks or so. It has now come to my attention that Carle Clinic is claiming that these letters were no longer supposed to be going out. That there is a new letter. Apparently one that does not tell families with Medicaid insurance that they have to go elsewhere for prenatal and well baby care. If it is the case that Carle Clinic has stopped Medicaid discrimination against pregnant women, then we would all agree this is great news. However, given their track record of discrimination, I think that if Carle Clinic is now truly welcoming of Medicaid patients, they need to be proactive, proclaim this to the community. Because otherwise, people, based on their recent and past experiences, will continue to stay away, thinking that they can't see the doctors who practice in these buildings. It is encouraging if Carle Clinic no longer sends expectant parents letters of this sort. But in measurable terms of expanded access, the proof will be in the pudding. More than half of the births in Illinois are subsidized by the Illinois Department of Healthcare and Family Services. That said, the Medicaid population in this county exceeds 20,000. According to data reported by Heartland Alliance, Champaign County has one of the highest rates of extreme poverty in the state. These facts beg the question, what share of babies delivered by Carle doctors are to families that rely on public assistance? If the clinic is honestly committed to healthcare access, this number should be considerable and on the rise. Ultimately, Carle Clinic has to stop treating Medicaid health insurance like a market commodity, accepting it inconsistently over time at their convenience. Low-income families in this community should be able to call Carle Clinic their permanent primary care home. Thank you.
Good morning. My name is Paulette Coleman. This is my daughter Brittany and my grandson Brennan.
Hey.
We are here today because we have been victims of Carle discrimination, Carle Clinic's discrimination. We are three generations of just one family that have been victimized by Carle's discrimination policy against Medicaid. How many more families are there? How many more generations of lives who have been discriminated against are here today to speak out on behalf of all the people who suffer Carle's discrimination. About 8 years ago, I had Medicaid. I was a Carle patient, but I needed oral surgery, and I was refused oral surgery because I had Medicaid. My son Stephen was also refused care at Carle because of a medical billing error on Carle's behalf. Since then, when Carle Clinic made that mistake with our Medicaid, they say we owe them money, and no one in our family has been able to go to Carle in the past 8 years. We have been forced to become Francis Nelson's patients. We are grateful for Francis Nelson, but I think it's really unfair that Carle Clinic dumps all of its unwanted patients on Francis Nelson, and Francis Nelson can barely keep up. Last year, my daughter Brittany gave birth to my beautiful grandson Brennan. When Brittany found out she was pregnant, she tried to get an appointment at Carle Clinic, but she was told in order to have her baby at Carle, she would have to get her prenatal care at Planned Parenthood or Francis Nelson. Although my grandson Brennan was born at Carle Hospital, he was never considered to be a Carle Clinic patient. To be a patient of Carle Clinic doctors, and he was not allowed to come to the clinic for well baby checkups. He had experienced discrimination before he was born. Claudia says this is a special form of Carle discrimination called in utero discrimination. Carle decided Brennan would be born at Carle Hospital but could not be a Carle patient. That's why Brennan's sign says, it's gone, born 12/27/06, banned 12/28/06. When he was discharged after his birth, he was not allowed to come back to Carle Clinic. How can you be born here but not be a patient here? They want to act like he is something that they took out of Brittany, like a tumor or something, not like a new little person. He didn't even get a Carle Clinic number or anything. Giving birth is one of the happiest times of our lives, but at Carle, you are made to feel bad because of the insurance you have, not like you don't count as much as a U of I employee or a state employee. Carle claims to be proud of the babies they deliver, but when you're not looking, they throw some of them out. Carle Clinic is saying they no longer discriminate against Medicaid patients. They no longer send out those nasty letters to pregnant women. But Carle Clinic has yet to formally make an apology to the community for the past discrimination, and they have not sent me and my family any letters welcoming us back to the clinic. I am glad for Medicaid patients who can get in, but I am going to keep fighting for all the people those with Medicaid and those who are uninsured who still can't get in. I don't want to see one more generation of my family be denied care.
All right. Good morning. My name is Ron Aker, and I am also a member of the Healthcare Access Task Force. I'm also a person of non-service here at Carle Clinic. As you have heard, Champaign County is experiencing a and discriminating policies, this would help bring an end to the community's crisis. Today, we are calling on Carle to change its harmful and discriminatory policies. Specifically, Carle Clinic should, first of all, guarantee access to care for everyone. Carle Clinic should stop denying or limiting services to people because of the type of insurance they have, such as Medicaid, or because of outstanding debt. Carle Clinic should accept and honor all major forms of public and private insurance. Carle Clinic should stop the practice of non-servicing patients. Carle Clinic should collaborate with other healthcare providers to help accept referrals and honor the financial assistance programs. For example, Carle Clinic should guarantee all hospital patients access to Carle Clinic doctors for follow-up and ongoing care. Care for all of Francis Nelson community healthcare patients. Carle Clinic should provide fair pricing for uninsured patients, giving them the same discounts as Carle Clinic gives the major insurance companies. Finally, Carle Clinic should work with patients to set up reasonable payment agreements, and then they should honor those agreements. These are changes that Carle Clinic could make beginning today. There is nothing preventing Carle Clinic from making these policy changes except their lack of desire to serve this community. If Carle Clinic made these changes today, thousands of Champaign County residents would no longer be in crisis. In the spirit of Thanksgiving, we are asking Carle Clinic to make these changes and open its doors to thousands of Champaign County residents who would be thankful to finally have access to timely, affordable health care in this season of Thanksgiving. To complete my statement today, I would like to lead all present here in a Thanksgiving prayer. O eternal God, creator and preserver of all life, I thank you for the opportunity to represent thousands of individuals who are being unfairly and unethically treated by this healthcare institution. I ask you, O God, to help those physicians who are in the policy-making position to remember their Hippocratic oath and open their doors to all who need medical assistance. I trust that we can add these changes to our list of things to be thankful for and celebrate this Thanksgiving Day. Unite us to ever care for those less fortunate and in need. Amen.
Amen. All right, we're ready for the delegation to go in. We're going to go deliver this card. The folks who are going in are Cindy, Jeff, Paulette, Ron, and I, Revisa, and Megan. And hopefully we'll get to deliver this card to Dr. Wellman and the board of directors or the administrators. If we're in there for a little while, we're going to call Allison. Revisa's going to call Allison, and Allison can report back out. But it would be great if people can start chanting again while we go in. And the people who are going in, please don't bring your signs with you. This is all we want to carry. Okay? Good luck.
Carle, you want to double check?
Carle Clinic, rich and rude. We don't like your attitude.
Carle Clinic, rich and rude. We don't like your attitude.
Carle Clinic, rich and rude. We don't like your attitude.
Carle Clinic, rich and rude. We don't like your attitude.
Delegation that went to deliver a Thanksgiving card to Carle Clinic's personnel. We were locked out at the front door when we asked to be admitted to see Dr. Wellman. The security people, a large force, said we were not allowed